This is what's going on, and there's nothing wrong with you. You don't feel good, but there's nothing wrong with you. Your brain, yourself, your psychology changed for a reason. If you are watching this episode, it's because you're either dealing with anxiety and/or depression, or you're interested in helping someone who is, or maybe just interested in understanding more about these mental health conditions. And in this series, there are 12 parts, this and 11 other episodes coming, to describe what is going on for a lot of people when it comes to experiences of anxiety and depression. There's a lot of research I'll be bringing in, a lot of practice, because I've been a psychotherapist for over 20 years, and hopefully helping you understand some parts of yourself and your experience and what happened to you, what happened to your brain, what happened to your emotions and your thoughts and perspectives, and giving you some information to lead you out of what you're experiencing now in terms of anxiety or depression and/or depression. This is not meant to replace psychotherapy or any mental health treatment. This is information that I absolutely believe you can use, and information you can use, in fact, with your mental health professionals. If you're seeing a psychotherapist, working with a psychotherapist, any sort of mental health counselor, a psychiatrist, a doctor, anybody, you can use this information. This is not therapy, this is information, this is education. And I really hope that it's helpful to you. After being a therapist for more than 2 decades, I have realized and fully understood or discovered that psychotherapy is an art and a science, or mental health is an art and a science. And it blends 3 factors at once. One is experience, or clinical application of all sorts of human nature understandings and mental health understandings, and what works and what doesn't work in psychotherapy. Observing my patients over time and looking at what they're dealing with and helping them understand this is what's going on. And I love telling people this is what's going on and there's nothing wrong with you. You don't feel good, but there's nothing wrong with you. Your brain, yourself, your psychology changed for a reason of living through or surviving situations, and how we can change that back, and you can feel better. You can feel a lot better. So there's application, that experience we get from being psychotherapists in mental health settings. The next item out of 3 is evidence. The research, the scientific research, helps inform us as clinicians, to help us inform our patients about what's going on. And there's been a lot of excellent research and evidence that's come from science over the past several decades. I'm going to share a lot of that with you because it matters. It matters to what's going on for you, it matters to you getting better, and it matters to understanding everything about your mental health. In addition to what you know and what you work around and what you work with, this information will be helpful, and it will matter to your overall understanding of your emotional well-being. And finally, the third part is evolution. That evolution plays an unbelievably important role in our mental health, and we don't realize that, and we really haven't explored that enough. But everything that you feel, everything you experience, it's all based on this biological processes that worked, that helped humans to live and to continue existing. So when I talk about anxiety and depression and what causes it and them and stuff, it's all based on evolution. Evolution shaped how we feel and how we respond and what's going on in our brain and our body in the moment. Our beliefs, evolution gave us this big mind, so to speak, to understand what's going on. So our beliefs really matter as to how we experience everything. But the brain and the body and the basic psychology is all shaped by evolution over a long, long time. So, experience, evidence, and evolution are critical to understanding our mental well-being, emotional well-being, and yours. Finally in this episode is to describe what's coming up. I'm going to look at my computer screen down below me here to tell you what's coming up for episodes and what they'll basically be all about. So the next one is all about Big Amy, Small Hippo, and your mental health. So Big Amy and Small Hippo are my nicknames for an enlarged amygdala and shrunken hippocampus. And they both matter. If they occur, they matter to how you feel every day. And I'll be talking about that. They're key to understanding anxiety and depression, in fact. Big Amy, Small Hippo. Primary emotions and your mental health is after that. And that is an understanding that, biologically speaking, all the evidence I can see and what I can pick up and also merge with my evidence or my experience here in my practice is that joy, fear, anger, and sadness are our primary emotions. And they're always working, they're always happening, and our experience of those can lead to, with life, on top of primary emotions, lead to anxiety and depression. Then the next couple of episodes are about PTSD or post-traumatic stress disorder and what that's all about and how that relates to our mental health. And then really importantly is toxic stress and how that relates to our mental health, because toxic stress or toxic fear, everyday fear, awful stuff going on to you leads to, again to my computer, leads to changes in the brain that are really instrumental, that Big Amy, Small Hippo stuff, and we'll be talking about that. But toxic stress is much more consequential to emotional change and emotional challenge than actually PTSD is. And I'll be talking about that and those distinctions. Next will be describing situational anxiety, like fears of certain things in your life or situations, versus generalized anxiety, which is a product of toxic stress in Big Amy or enlarged active amygdala. Generalized anxiety is a very important, it's probably the most challenging mental health situation, the broadest, most common mental health challenge is generalized anxiety. And then a description of situational depression versus generalized depression. So situational depression is something really has gotten you down. A relational thing or occupational, educational, just stuff in life. Situations make you depressed or extremely sad. But generalized depression is something different. That's from small hippo or an atrophied or smaller hippocampus. That's a feeling of nothingness. It's not even sadness anymore, it's a nothingness, and I'll describe that. But again, too much toxic stress can lead to a Big Amy, and after that, it can lead to a small hippo, and that's a generalized depression kind of experience. Next, I'll be talking about brain health, or how to change the brain if it's been changed by toxic stress, how to change it back to sort of more typical sort of brain sizes in terms of the amygdala and hippocampus, or Big Amy and Small Hippo, and talking about how that really improves how we feel. I mean, like, incredibly. I'll be talking about brain health and how to change it back if these changes have occurred because of toxic stress in your life. Next is psychological health, is cognitive shift, mindsets, changing your perspective, really essentially in terms of anxiety and depression. And when we do that along with changing our brain and changing relationships, those three areas I've identified, and I work with people here in my office, changing those three areas to improves one overall emotional well-being. Those three areas together, it's not just one or two, it's all three. So like I said, relational health, I'll be talking specifically on how to maximize your relationships, really loving, mutually caring relationships. I'll be describing how to do that, 2 basic steps. And I know a lot of people like me say 2 basic steps, but I really mean it. I mean, these things I use in my life. In fact, all of this I use in my life. And I use when I talk to my friends and family, and certainly here with my patients. So it works. All of it simply works. So in fact, the very last episode, I've called it Love, Change, Maybe Serotonin, like medication, and Your Best Mental Health. So those three things, when we're dealing with clinical anxiety and depression, where changes to the brain have occurred and maybe serotonin medications are part of it, but love, lots of love, change in terms of what you're thinking and believing and how that's affecting your emotions, and change in your life, changing, getting away from toxic things. Maybe serotonin to shrink the amygdala and enlarge the hippocampus if that's required. All those things lead to your best mental health. So that'll be the episodes coming up, the next 11 episodes, and I really hope they're helpful to you, because they're helpful to a lot of people that I've helped in my professional life and in my personal life. I hope all these episodes are helpful to you, because you deserve it and you are awesome.